Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Foot injuries and disorders. Introduction. Each of your feet has 26 bones, 33 joints, and more than 100 tendons, muscles, and ligaments. There are many common problems that can affect the foot. Foot problems can be caused by wearing shoes that do not fit. Aging and being overweight also increase your chances of having foot problems. Accidents or injuries can cause foot sprains or deformities. People with diabetes are more likely than others to have problems with their feet. This program will not discuss foot problems that are specific to diabetes. Instead, it covers general foot injuries and disorders. This program explains common foot problems. It also discusses how foot injuries and disorders can be prevented and treated. The foot and toes. The feet consist of many bones, joints, and soft, flexible tissues. Joints act as hinges. They separate bones. Joints, along with muscles, let the foot and toes move. Joints are covered by a fluid-filled sac that acts as a cushion. It is known as a bursa. The foot has 5 toes. The big toe is called the hallux. The big toe connects to the foot by a joint. This joint is known as the metatarsophalangeal joint. Bunions typically affect this joint. The bones in the forefoot that connect the toes to the ankle are known as the metatarsal bones. Each toe, except for the big one, is made of 3 bones or phalanges. The big toe only has 2 bones or phalanges. The toe bone that is the base of the toe is called the proximal phalanx. The middle phalange of the toe is called the intermediate phalanx. The final bone in the toe is called the distal phalanx. Toe bones connect to form the toe joints. The first joint that connects the toe to the foot is called the metatarsophalangeal joint or MTP joint. The second joint is the proximal interphalangeal joint or PIP joint. The final joint is called the distal interphalangeal joint or DIP joint. Each joint is surrounded by ligaments that hold the bones together. 2 tendons run along the base of each toe. These tendons allow us to curl our toes. A tendon that runs along the top of each toe allows us to raise the toes. Bunions. A bunion is a hard bump at the base of the big toe. It happens when bone or tissue grows around the joint. It can cause the big toe to point inwards towards the other toes. Smaller bunions can develop on the joints of your little toes. These are known as bunionettes. A bunion happens over time when weight is distributed improperly across the foot. This can enlarge the joint at the base of the toe. Improper weight distribution is usually the result of tight-fitting or high-heeled shoes. It can also be caused by injuries to the foot and the foot's shape. Bunions also can be caused by an inherited foot problem or arthritis. A bunion can be painful. It can cause a painful inflammation or swelling of the bursa. This is known as bursitis. A bunion may be treated by medicines to control pain, shoe inserts that reduce symptoms, taping and padding the foot, wearing shoes that fit properly. Surgery may also be needed in some cases. There are many surgeries that can treat a bunion. Most include a bunionectomy. A bunionectomy includes removing swollen or damaged tissue or bone, straightening the big toe, joining the bones of the affected joint permanently. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Calluses and Corns. Corns and calluses are thickened patches of skin. They are caused by pressure or friction on your skin. They often appear on feet where the bony parts of your feet rub against your shoes. Corns usually appear on the tops or sides of toes. Calluses form on the soles of feet. Calluses can also appear on hands or other areas that are rubbed or pressed. Wearing shoes that fit better or using non-medicated pads may help. To reduce the size of a corn or callus, gently rub them with a washcloth or pumice stone while bathing. Do not try to shave off the corn or callus. This could lead to an infection. A patch containing salicylic acid may also be used. The salicylic acid helps remove the thickened skin. If you have a foot deformity that is causing the corns or calluses, using shoe inserts may help. The inserts can reduce friction and rubbing in your shoes. Rarely, surgery may be needed to correct a foot deformity that is causing corns and calluses. Plantar warts. Plantar warts are non-cancerous growths on the soles of your feet. They are caused by an infection with human papillomavirus or HPV. HPV enters your body through tiny cuts, breaks, or other vulnerable sites on the skin of your feet. Plantar warts often develop beneath pressure points in your feet, such as the heels or balls of your feet. The pressure also may cause a plantar wart to grow inward beneath a callus. Signs and symptoms of plantar warts include hard, thickened skin over a well-defined spot on the skin, where a wart has grown inwards. Small, fleshy, grainy growths on the soles of your feet. Other signs and symptoms of plantar warts are black pinpoints, which are commonly called wart seeds but are actually small clotted blood vessels. Growths that interrupt the normal lines and ridges in the skin of your feet. Pain or tenderness when walking or standing. In children, warts often go away on their own. In adults, they tend to stay. Most plantar warts are not a serious health concern and may not require treatment. You should see a healthcare provider if your warts are painful, change in appearance or color, multiply. You should also see a healthcare provider if you have a weakened immune system, diabetes, nerve damage in your feet. Chemical skin treatments can remove plantar warts. Freezing, surgical, and laser treatments also can remove warts. Fallen arches. Fallen arches, also known as flat feet, are a common condition. You have flat feet when the arch on the inside of your feet is flattened. This allows the entire sole of your foot to touch the floor when you stand up. It is normal for babies and toddlers to have fallen arches. The tendons that hold the joints in the foot together tighten and form an arch as a child grows. Most adults have normal arches, but an arch never forms in some people. Fallen arches can develop in people who already have arches. It can be caused by aging, illness, injuries. Years of wear and tear can weaken the tendon that helps support your arch. Most people have no signs or symptoms associated with fallen arches, but some people experience foot pain, especially in the heel or arch area. Swelling along the inside of the ankle may also happen. Arch supports may help relieve pain caused by flat feet. Exercises to stretch the Achilles tendon may also help. Toe deformities. There are three main types of foot problems that affect the joints in the toes: hammer toe, claw toe, mallet toe. Hammer toe is a toe with a middle joint that is bent and curled. The first joint, or MTP joint, is cocked upward. The middle joint, or PIP joint, bends downward. The toe may be flexible or stiff. Hammer toe may affect any of the four smaller toes. Hammer toe is also known as bone spur, contracted toe, deformed toe, rotated toe. Joints in the toe buckle due to stressed ligaments and tendons. This causes the toe to point upward at an angle. Mallet and claw toes are similar to hammer toe, but they affect different joints on the toe. Mallet toe affects the joint at the end of the toe. Claw toe is the abnormal bending of the toe in all three of its joints. A claw toe deformity has a cocked-up MTP joint. Both the PIP joint and the DIP joint are also curled downward like a claw. Toe deformities have many causes. These include flat feet or feet with high arches, rheumatoid arthritis, shoes that do not fit well. Toe deformities may be caused by tendon imbalance. When the foot cannot move normally, the tendons may stretch or tighten. Injuries to the toes can also cause deformities.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Foot problems can be caused by wearing shoes that do not fit. Aging and being overweight also increase your chances of having foot problems. Accidents or injuries can cause foot sprains or deformities. A bunion is a hard bump at the base of the big toe. It happens when bone or tissue grows around the joint. It can cause the big toe to point inwards towards the other toes. A bunion happens over time when weight is distributed improperly across the foot. This can enlarge the joint at the base of the toe. Corns and calluses are thickened patches of skin. They are caused by pressure or friction on your skin. They often appear on feet where the bony parts of your feet rub against your shoes. Plantar warts are non-cancerous growths on the soles of your feet. They are caused by an infection with human papillomavirus or HPV. HPV enters your body through tiny cuts, breaks, or other vulnerable sites on the skin of your feet. Fallen arches, also known as flat feet, are a common condition. You have flat feet when the arch on the inside of your feet is flattened. This allows the entire sole of your foot to touch the floor when you stand up. Hammer toe is a toe with a middle joint that is bent and curled. Mallet and claw toes are similar to hammer toe. Mallet toe affects the joint at the end of the toe. Claw toe is the abnormal bending of the toe in all three of its joints.
Thank you for using Explain.